either, what do you think that the state or Oasis could do more of or better?
Well, there's a list. I guess on
Could
top
you
of
please write that list out and send it over to
on
us?
top of that list is really access to treatment when people are when people are ready.
Yeah.
As I think, Senator, you would understand, a lot of times it's a window of opportunity that you have. Sometimes
About
it's
this big.
48 hours. Exactly.
It's almost immediate when they
And you
need
got to be
it.
able to act and get somebody in and get somebody clean and started. We try to bring people in on, if we interview them and they are for us and they want to be there, we start them right then, right that moment. That's when they start. And then we figure out everything later, sometimes at the expense of
finding the beds and everything else. We're going to come to those questions very shortly.
The insurance and the whole 9 yards, and
Exactly.
it's a matter of.
If I could just answer on the ask, in
Sure.
terms of what we're referring to in the testimony. And that's a couple of things. One is that to put up a new bed and what it takes, the process and how long it is part of the problem. So one of the things we're asking for is an expedited application process, so we can get these things moving quicker. Some agencies, like Dynamite and other agencies, have property. We have a building. We have, so we could move it along quicker in that case. The other thing that we're asking for is when you talk about medication-assisted treatment, and I really wish Hillary was still here, because one of the things that we're seeing in Brooklyn, I have a list of 11 doctors who prescribe Suboxone. All of them, except cash only, all of them have a minimum of $150 to walk in the door. All of them have a system where the patient comes in, they get their buprenorphine every couple of weeks, and there's really no counseling attached to that. Some of them won't even work with us. Some of them have gone as far as saying to the patient that they don't need residential treatment as long as they take this prescription, and they maybe combine it with something else. So there's opportunists out there. There's people out there that are taking advantage of this epidemic in a way that's hurting people in the long run, because it's allowing them to stay addicted. They're really just maintaining, and that's what Colin was talking about before. So we ask that Oasis, and if we can, get the resources, the funding to do it to Oasis, give us the resources so that we can do this within our programs, and that you have under one roof to be able to provide treatment to people in terms of what they need. Colin talked about his experience getting to where he can be completely abstinent. You can't do that in a doctor's office, and that may work for some, but what we're talking about here are the resources to be able to do that, and also to maybe look and see what the doctors are doing, and to be aware of what the opportunities are bringing to this, because it's very disturbing to us on the day-to-day what we hear, and keep talking to the young people and the other people that are in treatment.
We certainly support medication when necessary, but we also think that there has to be some kind of treatment protocol attached to it for it to be anything that's substantial. And so, whether it's outpatient or inpatient, we also really feel if we could dispense medication within our program, then we could detox somebody within the program, keep them under our guidance, and keep them as part, and get the peer support that's necessary for that, and then obviously try to give them the best protocol that we can.
I will tell you that most of all of the education and the knowledge that I have on this topic now, since chairing the committee and co-chairing this task force, has not been just because of these task force. I've been in many, many providers, treatment providers, inpatient, outpatient services, all throughout the capital region area, and it's my district, and there's so many.
Absolutely.
And my district is 5 counties. It's a 140-mile stretch of New York State. Mm-hmm. So that gives me the best sense. It was when I sit and talk to the individuals who are sitting in the audience today. Yep. And they need to get involved. And they being here today is awesome. They are involved, but we need to continue, we need to get them more involved for their own sake, as well as to show everyone that, yeah, I was a user. Look at, and you would never think that they ever were. But they overcame, and their chains were loosened, and they overcame the stronghold in their life, and they are living victorious, and now they need to continue to pass it forward to help someone else. So thank you, Bill, for
Thank you.
your heart.
Thank you. We're going to, Karen, from the, Karen Remy, Chief Program Officer, Turning Points Community Services, followed by Josephine Beckman, District Manager, Community Board 10.
Okay,
Karen?
thank you. Good afternoon to the task force chairs, Senators Murphy, Amador, and Ort, to Senator Golden, staff, guests, and neighborhood residents. Thank you for the opportunity to testify before you today about the public health issues related to heroin and opiate use in our neighborhood and the roles we play in the prevention of increased use and overdoses. My name is Karen Remy. I am the Chief Program Officer for Turning Point Brooklyn. We have been serving the Sunset Park and neighboring areas for 40 years. We provide an array of services, including transitional and permanent housing, high school equivalency, English for speakers of other languages, and college, job readiness, and placement. We also have HIV, hepatitis C, prevention, testing, case management, and we have a needle exchange. We have an outpatient drug treatment that is medically supervised and certified to administer Suboxone. I was born in Sunset Park and raised in Bay Ridge and Dyker Heights. I am grateful to be speaking to you here today, not only as an expert in the treatment of addictions, but also as someone who cares for the neighborhood and its people. I also love someone with an opiate addiction. Today, I would like to impart information to you as well as those seeking more knowledge on opiate and heroin addiction, those who are using drugs, and those who are concerned about someone who is using drugs. Just a little bit about our treatment program, which is located at 5220 4th Avenue in Sunset Park. 56% of our clients in treatment are opiate addicted. 47% to heroin, and 9% have a primary substance abuse of OxyContin or other opiates. 19% are in treatment for alcohol, 6% for cocaine, and 2% for crack. Some of our clients have secondary drugs that they use. Alcohol, 25% of our clients, cocaine 21%, and marijuana 11%. So why are we here today? We are here because the rate of heroin-involved overdose deaths increased each year from 2000 to 2014 for a cumulative 88% increase. We are here because heroin was involved in 57% of all overdose deaths in New York City, making it the most common substance involved in overdose deaths. We are here because 55% of heroin-involved overdose deaths among New York City residents were among residents of Brooklyn, 29%, which is 116 deaths, and the Bronx, 26%, which was 103 deaths in 2014. We are here because from 2013 to 2014, rates of heroin-involved overdose deaths more than doubled in Bensonhurst and Bay Ridge. We are here because from 2013 to 2014, New Yorkers aged 35 to 54 had the highest rate of overdose deaths involving heroin. We are here because among New Yorkers aged 15 to 34, the rate of heroin-involved overdose deaths more than doubled in 2010 to 2014. We too are concerned about the trajectory from prescription opioid use to heroin use. Prescription opioid misuse remains one of America's biggest drug problems. In recent years, the number of people misusing prescription pain relievers had leveled off. However, the number of people dying from overdoses continues to rise, and a new epidemic of heroin use has emerged as many people misusing prescription opioids transition to the cheaper, often easier to obtain street relative. So I have a couple of more statistics that I'd like to share. This is most of the next statistics are pertaining to young people. In 2011, 7% of New York City students in grades 9 through 12 reported past year non-medical use of a pain reliever. That is information from the New York City Department of Health. There was a small study done by the NIDA, which is the National Institute on Drug Abuse. And in this study, they worked with 33 young people, ages 18 to 32, and they reported non-medical pill use at least once in the past month. All of them said that their use was initiated early mid-teens while in high school. Cost-free access via family member prescriptions, and our friends with the same. Once this access is gone or dependence increase, they will return to street purchasing. Pills are expensive, heroin is cheap and longer lasting. 92% of people who use pill proceed to heroin use. 24% start with injecting. 75% with sniffing. Within 9 months, all had injected heroin. And there was, in this cohort that they studied, there was a huge overdose risk because, these were kind of they were young people, and the purity of the drug was inconsistent, and just their lack of experience. The strongest predictors of initiating heroin use were non-oral use of prescription opioids. Early age of onset of illicit prescription opioid use was also a predictor of heroin initiation. Like I said, I just want to, talk to all the people in the audience who may be here for different reasons. And, I want to tell, if you are somebody that is concerned about somebody, educate yourself. You need to have a clear, knowledgeable understanding of what you and your loved one are going through. There's two Facebook pages that I've been on that have been very helpful. There's one called The Addict's Mom, and then there's another one called The Fix, which is for information. If you or someone you know is using and does not want to stop, learn how to use safely. Use needle exchanges and find out about safe use practices. Via the Thrive, a program called Thrive New York City, we are trying to increase the number of doctors who can prescribe Suboxone, a med that treats addiction by stopping cravings and withdrawal symptoms. The mayor has a task force called the Heroin and Prescription Opioid Public Awareness Task Force. It's chaired by Health Commissioner Bassett and Staten Island Borough President Odo. And I'm looking to them, as well as the other task force that are happening in the city, to give us these task forces have to have teeth. They have to have results. We need to continue measures to reduce inappropriate opiate prescribing, prevention education to those who take these prescriptions about keeping them out of the hands of others, education and access to harm reduction and recovery services for those who are addicted, prevention programs in schools that specifically address the range of opiates, and most importantly, if you have questions or concerns, please reach out to service providers such as Turning Point, such as the Resource Center, such as Dynamite, and any other colleagues that I have that are here. Thank you.
Karen, we're probably going to come back to you shortly. I'm going to talk about education. I'm probably going to ask the questions what age should we start? What grade should we start? And are we starting early enough? And the curriculum in the state of New York, does it need to be updated? But we're going to come back to you on that. Go ahead, Josephine.
Thank you, Senator. My name is Josephine Beckman, and I'm the District Manager of Community Board 10 in Brooklyn, representing the communities of Bay Ridge, Dyker Heights, and Fort Hamilton. And for those of you not familiar with what a community board is, we're a local municipal agency, and we have an interesting composition in that we have 50 volunteer members that live throughout the community that listen to various issues, including service delivery needs. And I'm here today to speak because, as we have heard from those who have testified before me, we have a problem with addiction in Bay Ridge and Dyker Heights, and some of that data is staggering. As district manager, a big part of my job is reviewing complaint data via community board complaint logs, the 311 open data, as well as the New York City Department of Health. And Senator, to your point earlier, I think it really is important that we kind of own in on the Department of Health and making sure those statistics are accurate and include suicide and include secondary causes of death, which we have heard anecdotally. And those statistics become important as we advocate for city service delivery needs within the district. So in 2014, the drug epidemic came to our doorstep at Community Board 10 when everyday residents came and brought to our attention rampant street-level drug use that included many residents seeing young teens smashing opiate pills and snorting them very much out in the open. And families began to come in with stories of loved ones who were addicted, and the list goes on. So in 2014, Community Board 10 formally organized a response to the sharp uptick in complaints about the street-level opioid use. We transitioned from a reactive and referral approach to community concerns brought to the board and joined with agency officials and our elected officials to form our own Community Board 10 Drug Abuse Task Force. CB10's Drug Abuse Task Force was comprised of members of CB10, elected officials, community organizations, and leaders. There were 3 ad hoc committees of our health committee, which included education, treatment, and enforcement. It was at those meetings where board members met with leaders of treatment services who are here today, district and citywide educational leaders, and our district attorney's office, local precinct commanding officer, and narcotics enforcement. And we too felt very important that we erase that stigma that was attached because we saw a real health concern in the district. So on education, CB10 reached out to every elementary, middle, and high school in Community District 10. We held red ribbon drug awareness events and encouraged local schools to add special assemblies and programs and to advocate for funding to heighten awareness. On treatment, we advocated for counseling services and subsequently met great people who's now a board member, Donna Mae DiPola, who testified earlier. And we now have a resource counseling center that opened up a satellite office on 4th Avenue. On enforcement, we participated in meetings with residents and police on recurring drug locations and educated residents on reporting information. CB10 realizes education and treatment efforts are costly, but are critical to prevention and critical to treatment. CB10's task force offered findings which included the following. The first, continued support of the NYPD and community training on Narcan naloxone. 2, the availability of treatment resource information at local precinct station houses, government office, libraries, wherever possible. 3, prescription drug boxes at local precincts. 4, preventative education funding for elementary through high schools. 5, to encourage opioid heroin use reporting collaboration via NYPD's best practices, similar to that offered to nightlife establishments without fear of violations. 6, funding for Department of Health substance testing and business inspection, especially in some problematic locations within Board 10 that sell hookah because of the number of adolescents and complaints of illicit drug use that tries to get young people hooked. 7, a citywide drug hotline for families and persons facing addiction to get confidential help, referral assistance, both reporting and treatment resources. 8, continued funding to the district attorney's office for reporting confidential drug sale information by county. We are very concerned about the consistent pace of heroin, opiate, and other substance abuse problems, including ketamine and synthetic drugs facing residents within our community. The members of Community Board 10 strongly feel that sustained counseling and treatment funding is needed to help those facing addiction. In the longer term, we will continue to support education and prevention efforts statewide. Thank you for the opportunity to testify in your work on this issue, and I think we really are, in the last few years, making that curve into erasing the stigma and really working together to get help to those in need. Thank you.
Josephine, you and your office have done an outstanding job and continue to do an outstanding job, whether it's dealing with the narcotics issue here or the ongoing issues at the Prince Hotel, which we talked about earlier, or the pain management locations that are opening up. So to your members, I say thank you very much. Please keep up the great work. David, we can hear from you, and then Christine, and then we'll go to questions from myself and my colleague, and then to the audience.
Thank you. Thank you, Senator. Thank you for inviting me. My name is David Bachner. I am the Executive Vice President of Cornerstone Treatment Facilities Network. We have 2 locations in New York. One is in Queens. We have a 161-bed short-term inpatient facility, and we have a 96-bed facility in Rhinebeck. And once again, thank you. One of the reasons I'm here, and I'm going to go quickly because it's late Friday afternoon, is that we're turning people away every night for detox. Every single night, I'm turning 15 to 20 people away because I don't have any beds. There are no beds in New York City for heroin and opioid treatment, short-term beds. In order for patients to get to Turning Point and to Dynamite, they need to be detoxed first. They need a few days, 5 days, 4 days, 8 days, whatever it takes to get the drugs out of their system. When I started in the field as a social worker 25 years ago, in East Harlem, the drug of choice was crack and crack cocaine. All of us sitting here know the difference between crack cocaine and heroin and opioids, but a lot of lay people don't. Crack cocaine is not physically addictive. Heroin and opioids are. Let me say that again. Crack cocaine is not physically addictive. Heroin and opioids are. What do I mean by that? When you're a heroin or an opioid addict and you stop taking drugs, you go into severe withdrawal. Nausea, diarrhea, vomiting, the worst case of the flu you could ever imagine. You need to take drugs, heroin or pills, not necessarily to get high, but to feel normal. Imagine waking up every day needing to use a pill or shoot a bag of dope to feel normal. That's what we're facing now. That's the epidemic. Going to an emergency room or a general hospital for a couple of days isn't detox, and it's not short-term rehab. That's called getting the drug out of your system and walking right back into the nightmare that you live outside. It doesn't work. We need to stop sending people to emergency rooms. We need to get law enforcement to stop bringing people to emergency rooms and bringing them to treatment centers instead. Everyone wants treatment available for everyone. I think it was Senator Murphy that was talking about, and everybody up there, the stigma of addiction, which I do think is going away. I do believe there's a destigmatization of addiction going on.
Not in this community.
Well,
Go ahead, David, I apologize.
No,
I'm
not
trying
at
to
all.
wake up some of my community, that's why I did that.
That's a shame. And it's an individual stigma, it's a family stigma. I think, Senator Golden, you mentioned a clergy stigma, but it's an entire neighborhood stigma. We are trying to open new programs and new detoxes throughout the boroughs. Okay, we're the bad guys, we're private, we're not asking for any money from anybody. And the reason we can't open them is that nobody wants it in their backyard. Everybody talks a good game, but when it's time to treat addicts, I think Dr. Kunis said people are leaving the state and leaving the city and going on vacation in Florida and California, and then they're coming home to the same people, places, and things, and they're not getting the treatment they need. Let's work within the city and in the state the stigma attached. No one wants it in their backyard, and that's what we need to change. If there are addicts in this neighborhood, and in my neighborhood in Queens, and in neighborhoods throughout the Bronx and Manhattan and Staten Island, let's get treatment centers open. I can't send referrals to the great people that do the work they do here without the short-term intervention on an inpatient basis that they need. So that's why I'm here. I appreciate you allowing me to be here, and happy to answer any questions. Thank you.